More than 50% of testicular cancer cases are diagnosed in what age range? How often is a new testicular cancer diagnosis given? If caught early, how curable is testicular cancer? Pause this video for a few minutes and discuss the following questions. When you're ready to resume the video, please press play. Hi, I'm Justin Burkbickler. I'm 26 years old and I'm a 4th grade teacher near Fredericksburg, Virginia. While I normally spend most of my days teaching students who are about 10 years younger than you, I'm here to talk to you about something I'm extremely passionate about. You can't tell it just by looking at me, but I'm a testicular cancer survivor. In the summer and fall of 2016, I was a picture of health and happiness. I was preparing to marry my fiancée, Mallory, in the summer, and we had just bought a new home. I had recently participated in my first Spartan run and had no problems balancing my busy schedule of teaching or keeping up with our new puppy. However, all of that changed quickly. I remember the date so clearly, October 6, 2016. I was taking a shower and performing a self-exam. On my left testicle, there was a hard, pea-shaped lump. I don't remember it being there before, and I knew it definitely shouldn't be there. I immediately called a doctor and my worst fears were confirmed. It was cancer. According to the American Cancer Society, cancer is defined as out-of-control cell growth. This crowds out the normally healthy cells and makes it very difficult for the body to function. The next week was a blur. I met with 3 different doctors over the next 6 days. I then had a surgery to remove my left testicle. I can tell you that surgery was simply not a ball. Even though I had caught the cancer early, it had still spread to my lymph nodes. I needed 9 weeks of chemotherapy. To put it bluntly, it was a grueling experience, but I did try to keep the most positive attitude I could. I lost my hair, had a weakened immune system, and became well acquainted with this bucket for an entire week. Finally, on January 30th, 2017, I rang the bell. Chemo was over. After a follow-up visit, my doctor told me that I was in remission. There was no active cancer cells in my body. Now you may be thinking, Justin, you're older than me. This won't happen to me. Unfortunately, that's just not quite true. Over 50% of all testicular cancer patients are between the ages of 15 and 35, which includes you. But you don't have to take my word for it. Here's a fellow survivor's story who was just 17 at the time of diagnosis. Currently, he's a high school senior.
I'm Grant Mosley. I moved to Tennessee from Georgia in July 2016. I was looking forward to my junior year in high school and getting my driver's license. In November 2016, I noticed pain and swelling in my right testicle. I went to a doctor's office the next day. My life changed in an instant, and ultrasound showed a solid mass. I was sent for blood work, then scheduled to have my right testicle removed the next day. did not attend classes at school January through mid-April. I also had to stop attending church, Boy Scouts, and youth group due to flu, cold, and other illnesses around Knoxville, Tennessee. After treatment, I was sent for a CT scan to see if my enlarged lymph nodes had responded to the chemo. Imagine my shock when I found out they had not. Just in time for the ACT exam. My surgery was scheduled for May 8th. But first, I was able to attend my high school prom on May 6th. My surgery lasted almost 7 hours. I stayed in the hospital 3 nights. I recovered quickly from the surgery. I even went to Boy Scout camp 4 weeks later. I'm not athletic, and some of you might not be either, but I'm sure you can identify these balls. My hope is that all males check their own balls at least once a month. If you have any symptoms, please let a parent or doctor know.
Our stories could have turned out very differently had we not been aware of changes happening in our body or performing regular self-exams. Your doctor may be doing a check with you every year at your annual physical, but my annual physical is in July. I found my lump in October. Imagine what might have happened to me had I waited the 9 months until my appointment. You need to be taking your life and your health into your own hands, and I mean that quite literally. The primary way testicular cancer is discovered is through monthly self-exam of your testicles. A great place to do a self-exam is in the shower. Your scrotum is relaxed, it's private, and you probably already have your pants off. Be sure to examine each testicle separately. Using both hands, place your index and middle fingers under the testicle with your thumbs on top. Firmly but gently roll it between your fingers from top to bottom. Familiarize yourself with the epididymis, a series of cords and structures located behind the testicle. If you know what this feels like, you won't accidentally mistake it for a lump. Repeat this process on the other testicle. Any abnormal lumps or bumps should be checked out by a doctor as soon as possible. Aside from the epididymis, located towards the top, your testicle should feel relatively smooth. Anything hard is worth getting looked at by a doctor. When you get out of the shower, look for any changes in size, shape, or texture. It's normal for one testicle to be slightly larger, but if you see excessive swelling, please call a doctor. The lump does not have to be painful for it to be a concern. It's just that easy. It takes about a minute total, and you need to be repeating this process every month. Keep track of any changes between exams and contact a doctor or your parents if you have any doubts. You can never be too careful. As demonstrated in the pre-assessment questions, testicular cancer is very curable if caught early. While a testicular self-exam won't prevent cancer, it can mean the difference between a 2-hour surgery and many months of chemo. Here's my challenge to you. Make a commitment to doing a self-exam every single month. Choose a day and stick with it. Don't drop the ball. It will only take less than 15 minutes for the entire year. You can also get monthly text message reminders from the Testicular Cancer Society by texting @self-exam to 81010. Your cell number is kept private and the society does not have access to it. But checking yourself isn't enough. I need you to be on the ball and help get the word out. While you may not be a proud owner of testicles yourself, we all have men who are important to us in our lives. Whether it's a brother or father, an uncle or a grandfather, a friend, a boyfriend, or a fellow athlete. No man is immune from developing this disease. While the majority of testicular cancer cases occur in teenagers and young adults, any man of any age can develop testicular cancer. Eliminate the excuses of not knowing how or the importance of regular testicular self-exams. You just learned how to do one, now teach someone else. Encourage them to pass it on. Together, we can get the ball rolling on testicular cancer awareness and the importance of regular testicular self-exams.